Hi, this is Marcy White at Copley Acupuncture, and in today's video, I wanted to discuss low back pain. I think this is one of the most common things that people come to acupuncture for. Most acupuncturists around the world would probably agree this is a pervasive issue, and most adults in their lifetime are going to have some kind of episode of either acute or chronic back pain. And as anyone that is dealing with it knows, it is extremely debilitating. So acupuncture really works well for back pain. We can really, as acupuncturists in the United States, credit James Reston, who was a New York Times reporter, with really bringing to light in America how acupuncture works and how much it can help with pain relief. He was a New York Times reporter who went to China in 1971 ahead of Richard Nixon's visit as part of a group of people that were going to be covering the story. And he had an acute appendicitis. So he had his appendix removed in the hospital, but a couple of days post-op, he had a lot of pain. And they brought in an acupuncturist who did some points on his arms and legs and really helped with that post-op pain. So he wrote an article about this in the New York Times. This really sparked interest in what acupuncture could do and how it can help with pain. So when we're treating low back pain, there's a lot of different factors we want to take into account. Just like anything that we treat, and I've talked about in some previous videos, we want to find what's called your pattern and treat based on what your presentation of your problem is. So we want to see, where is your pain located? What does it feel like? What makes it feel worse? What makes it feel better? And we're going to treat you very individually. So acupuncture can help on so many different levels with low back pain. It can help the muscles to relax and help with spasming. We can increase blood flow into tissues. So if there's been trauma, increased blood flow will help that to heal. We also have treatments that we can do if you have what are called paresthesias, numbness and tingling in the legs and feet, or sciatic type pain. So you can needle close to the nerve root of the vertebrae that are causing this dysfunction in the nerve signaling, and we can calm that down. We can also get endorphins released, which help with pain relief. I love to use my low-level laser on spinal stenosis, which is a narrowing of the spinal canal, and it limits the blood flow and can cause bone spurs. The laser is great at penetrating deeper into tissue and getting to areas sometimes I find that acupuncture needles might be a little bit limited with. So these are a lot of different combinations of things that we can do for low back pain. But as always, as I've discussed in some other videos, everything is about pattern discrimination and determining what your issue is first and then going from there. But it's a wonderful option. There's a reason why most insurance companies never deny low back pain as a diagnosis when they're reimbursing people that take insurance, because it has been proven in so much research to really help significantly. It's one of the first things that the World Health Organization recognized acupuncture could treat in the 70s. So if you're dealing with chronic or low back pain, definitely acupuncture is something worth giving your consideration. And I appreciate you watching this video, and thank you so much. I hope this was helpful.